The Consumers Association of Penang has urged the government to control the price of COVID-19 screening tests at private clinics so testing becomes more accessible to all. Would reducing the price of COVID-19 tests bolster our pandemic response, and are private healthcare practitioners receptive to this idea? We spoke to Datuk Dr. Kuljit Singh, President of Association of Private Hospitals Malaysia, and Professor Datuk Dr. M. Subramaniam, President of the Malaysian Medical Association, for their take on the matter.
We must also understand the whole testing has got a process and there is a cost to it. We want to have it feasible so that it is also sustainable by the private doctors and private hospitals to keep doing the tests. We definitely are looking at making the tests affordable to the public so that more can do the tests without any issue. To some extent, yes, there would be a better management of the pandemic if more tests is done. Perhaps it is probably a suggestion that if the government can help out in subsidizing some of these tests so that the cost can be shared.
The general practitioners or the private sector, it must have to include all these costs. Can't just take, they only $100, they are testing $200. But you must understand, if you open a clinic, they have to run the air conditioning, they've got to look at the electricity, they have to pay the rental for the place. You might say, this rental is already been agreed on a monthly basis, but the monthly basis rental is divided over a period of time. To cover that, there must be income coming. So this is not say they are making income cover the cost.
The Health Ministry had previously said it was in the midst of studying measures to control the price of RT-PCR screening tests at private hospitals and clinics that can be implemented through the emergency ordinance. How can we make COVID-19 testings affordable for the public and at the same time sustainable for private healthcare practitioners? Dr. Kuljit weighs in.
I think it's fair to sometimes have some sort of control for price of the test. But before a price test is decided, it is important that the government stakeholders and the regulators have discussion with the private sector so that the price capping that is decided, it is acceptable and also, as I said, sustainable to run the test. We do not want a situation when the test is too cheap that many of the private providers will stop doing the test because it is not sustainable for their business.